Hello, my name is Allison Ritter. I am a student in Dr. Manning's medicinal chemistry class at Valdosta State University. My project is on the 2014 Ebola outbreak in Africa. Ebola hemorrhagic fever is a highly infectious disease that is making headlines worldwide due to its destructive potential. Our question, could it ever enter the U.S., has already been answered, with 2 infected Americans receiving treatment here. The question now could be, could this deadly disease ever erupt in America and cause damage comparable to the multitudes of damage of that in Africa? This project will examine Ebola's overview, the causes, signs and symptoms, and treatment. And then we will look at the specific outbreak in 2014 in Africa and see what the CDC is doing to control it. I will start out with giving an overview of Ebola. The Ebola virus was discovered in 1976 near the Ebola River. It is a member of the family Filoviridae, more commonly known as a filovirus. Its reservoir in nature is unknown, although many suspect that bats and bushmeat, like monkeys and large rodents hunted for food, are culprits that introduced the virus into the human population. Ebola is an aggressive, often fatal illness, killing between 60 to 80% of its victims. Infections with the Ebola virus are characterized by immune suppression and a severe inflammatory response that damages vascular, coagulation, and immune systems. Once inside the body, the virus begins to slightly separate the walls of the capillaries, causing blood leakage, low blood pressure, and poor circulation, subsequently resulting in massive internal bleeding, multi-organ failure, shock, and ultimately death. A person infected with the Ebola virus may begin experiencing symptoms 2 to 21 days after exposure. Early diagnosis is sometimes difficult. The early symptoms are nonspecific to the Ebola virus and includes red eyes and skin rashes. Later symptoms may include fever greater than 101.5 degrees Fahrenheit, severe headache, muscle pain, fatigue, weakness, diarrhea, vomiting, abdominal pain, and unexplained hemorrhage or bleeding and bruising. Recovery from Ebola depends on a patient's immune response to the virus. Those with weakened or compromised immune systems would have a more difficult time recovering from this disease. According to the CDC, people who recover from the infection develop antibodies that last for at least 10 years.